second talk. Again, we do not have any disclosures. So the urinary bladder is composed of multiple layers and multiple cell types. This structure is supported by a complex network of collagen and elastin fibers, which are termed the extracellular matrix. The ECM allows mechanical changes to occur during normal bladder filling and emptying. In aging, there are remarkable changes in the properties of the ECM to collagen and elastin, including increased fibrosis, which may lead to bladder dysfunction. In our studies, we took bladders and opened them and placed them in a specially designed chamber, which then fits in a multiphoton microscope. We used mechanical loading and multiphoton microscopy to examine the collagen organization, realignment, and recruitment, as shown in these images at the top. Our overall goal was to examine how ECM components such as collagen contribute to mechanical behavior in bladder health and disease. In the young bladder shown on the left, when the bladder is fully stretched, the collagen fibers are taut and become straight. In the image on the right, showing a fully stretched aged bladder, some of the fibers are straight, but a good portion of those fibers are wavy or tortuous. This decreased elasticity of the collagen matrix during bladder filling may result in a stiffer and non-compliant bladder. Increased oxidative stress in aging may lead to protein damage. So in this image, we have a stress strain curve, which shows an increased stiffness in the aged bladder. Stress-induced recruitment of aging collagen fibers occurs much earlier, leading to stiffness at lower bladder pressures at earlier stretch. And this was reduced with treatment with an antioxidant, so the curve shifts to the right. So as we saw in my last presentation, mitochondrial health is very important, and it's an important factor in aging. And here we show a significant increase in oxidative stress in the aged urothelium, which was significantly reduced with the antioxidant treatment. And we pressed a button. There we go. So in summary, the coordinated recruitment of collagen across the bladder is essential for the large elasticity of the bladder wall. Oxidative stress significantly contributes to ECM dysfunction, and new strategies such as antioxidants that target specific mitochondrial pathways in the dysfunctional bladder may be useful in treating a number of bladder conditions. Thank you.
Yeah, thank you. Are there any questions from the crowd? I'm glad to see that the plan is here. So, can you
let this go? Oh, that timer was for the first 7 minutes. You have 7 minutes for the discussion.
7 minutes.
Sorry, this wasn't supposed to go off. It's supposed to buzz. I'm not very good at these androids yet.
No, I just had a question. So do you think there would be advantage to antifibrotic agents that could suit,
Yeah, I think it would depend on the agent, but possibly.
But I presume that preventing antioxidant damage prevents disruption of the urothelium and inflammation. Okay, very nice talk.
So Amanda, what do you think metformin would have on these things that you measured with the mitotempo? Would it also have the same effects, you think?
It works in a different way, but it also, both agents target the mitochondria. So mitotempo was the antioxidant used in the second study, and it has a moiety that targets the mitochondrial membrane, and it actually goes in the mitochondria and reduces oxygen species. Metformin, on the other hand, as most people are familiar with it, is an older drug that's used in type 2 diabetes, but its exact mechanism is not known. The TAME trial picked metformin because it has a number of different effects. Their studies have shown that it can reduce cardiovascular disease, it can reduce cancer, proliferation of cancer. So it has a number of different mechanisms, but they're not all fully elucidated. But how they think that metformin works as an antioxidant is that it targets the electron transport chain number complex 1 within the mitochondria, which is a significant source of oxygen species. So that was a long explanation for a short question.
Well, I really wanted to know whether you think it would affect this stretch
Metformin.
Metformin. Have you tested that yet?
We have not. No, that's a good question. Yeah.
Good morning. Thijs
Morning.
from the Netherlands.
Yeah.
I have a question about the first study as well.
Yeah.
Metformin is already used in diabetes patients.
Correct.
And in your abstract, you show that you had a decrease in voided volume, I think, right? In your rats
With metformin.
with metformin.
We do.
I was wondering if you know of any data that's available for changes in lower urinary tract function in these diabetes patients that are getting metformin.
That's a good question. I don't know.
It would be very easy to give them a nutrition diary.
It would be. Yeah.
It's very interesting.
Thank you.
Okay, if there's no further questions, thank you very much. Excellent presentation.